Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today we are joined by County Executive Armond Budish, Board of Health Commissioner Terry Allan, and University Hospitals Rainbow Babies and Children Pediatrician-in-Chief Dr. Marlene R. Miller. We will begin by hearing from our county leaders and then end with some questions. Thank you, and with that, I will turn it over to Executive Budish.
Thank you, Devin. I want to again thank Commissioner Terry Allan and his team at the Board of Health for working so hard to keep us safe during the pandemic. As I've discussed before, the pandemic caused lots of people to lose their jobs, and it revealed inequities throughout the county. We're attacking these problems through a variety of initiatives and programs. And today I want to announce two new programs to train people for the building trades with a special focus on minorities. When I first entered government, I remember leaders of the building trades telling me that their members can't get enough work. Construction was slow. Well, that's definitely not a problem now. Building is busy. Today, it's often tough to find qualified trades workers. Construction jobs are good paying jobs. A few days ago, Business Wire published a piece noting with technical training, whether in a trade school or through an on-the-job apprenticeship, today's high school graduates can have solid job security with very competitive pay for their entire career. We want to help people get good paying jobs leading to a career. And I'm thrilled to announce that we'll be partnering with the Cleveland Building Trades to do just that. Through a proposed collective bargaining agreement subject to County Council approval, we'll be supporting Cleveland Builds, a nonprofit organization to provide pre-employment education and training for electricians, carpenters, plumbers, and other building trades. Cleveland Builds will be reaching out to the community to encourage people to consider a career in the building trades, and they'll be focusing their recruitment in minority communities. The county government, which employs over 100 tradespersons, will participate as a sponsoring employer by providing paid work opportunities and training through a pre-apprenticeship program. The county will hire pre-apprentices as temporary full-time employees, focusing on providing job opportunities for female and minority tradespeople. Each participant will be placed with a journeyman foreman who will serve as a mentor, and for 2 months, they'll continue that. Then they will enter a full apprenticeship following. The program helps build the needed pipeline of trades personnel and creates a more diverse workforce with good paying jobs. And there's one additional new initiative, again focused on equity. We at the county typically hire building tradespeople from the Cleveland Building and Construction Trades Council from a list that they'll provide us of 10 qualified candidates. Under our new initiative, these hiring lists will now contain at least 30% minorities and women. This too will help us ensure more people of color and women get into these good paying jobs. I want to thank Dave Wondolowski and the Cleveland Building Trades Council for their partnership and support. Now I'd like to talk about something that still ravages our community, and that seems exacerbated by the pandemic. That's the opioid crisis. Our medical examiner, Dr. Thomas Gilson, issued a public health alert earlier this year, highlighting the high number of overdose deaths that he's been seeing in the county. Based on our current rate, we could see over 700 overdose deaths this year. The last time we saw such high numbers was in 2017. Almost all of us know someone who's been taken from us because of this deadly, deadly addiction. Today, I'd like to announce that the county has directed $2.3 million to the Case Western Reserve University School of Medicine, the fiscal agent for the first-year Cleveland Infant Mortality Reduction Program, for two strategies directly supporting infants and mothers dealing with substance use disorders. These funds support two strategies that are called Rise Moms and RISE PEDS. Funding for these programs comes from our opioid litigation settlement with Johnson & Johnson in 2019. Under the RISE programs, University Hospitals Rainbow Babies and Children will provide treatment and recovery services for mothers and their children dealing with opioid addiction. This includes medical treatment, counseling services, and connection to external partners and programs that can help keep mothers on a positive path forward towards recovery. The funding we've provided allows UH to expand their scope of services and make sure moms and babies have the services that they need. Funding will go towards the hiring of 2 social workers that will provide individual and group psychosocial intervention and coordination. It'll also support the creation of an evaluation program and will support multidisciplinary medical experts in obstetrics, pediatrics, and developmental behavioral pediatrics. The RISE programs help provide long-term support for mothers and children. We want mothers to be successful in spite of their substance use issues by providing them with helpful resources to support their ongoing recovery. We're joined today by Dr. Marlene Miller, University Hospitals Rainbow Babies and Children's Pediatrician-in-Chief and Professor of Pediatrics at Case. She's graciously joined us to speak to the importance of these programs. Thank you, Dr. Miller, for joining us.
Well, thank you, Executive Budish, and also a thank you to Case Western Reserve University School of Medicine for supporting this important program at Rainbow Babies and Children's. Through extensive research, we know that mothers experiencing addiction who have a strong support system have a greater chance at recovery. The goal of our RISE program is to surround mom with a team of experts throughout her journey while keeping mom and baby together as much as possible. The RISE program at Rainbow Babies and Children's is a team-based approach to caring that puts the mom and child at the center of each decision. Professionals specializing in women's health, addiction medicine, mental health, and pediatrics will walk mom through her pregnancy and through the first 2 years of parenting. This will create opportunities for mom and her care team to overcome barriers that may arise along the recovery journey and ultimately lead to healthy and happy mother-child relationships. We are thrilled to be able to offer this comprehensive program at the UH Rainbow Center for Women and Children's in Midtown. Our community deserves the best healthcare, especially those in deep struggles while bringing a child into this world. We are proud to have the talent and the infrastructure at Rainbow Babies and Children's to offer this critical care and grateful for the support of Cuyahoga County to do so. Thank you.
Well, thank you, Dr. Miller, and thank you, Executive Budish, as always, for your continued support of the Cuyahoga County Health Department and our staff throughout the pandemic. We're very glad to hear that the county will be directing $2.3 million to CASE as the fiscal agent for First Year Cleveland infant mortality reduction program to fund strategies for infants and mothers dealing with substance abuse as part of the litigation settlement, and look forward to working with our partners at UH. Supporting moms and families in treatment and through recovery will have major positive impacts on the trajectory of families in crisis. Certainly, as a county executive has noted, this has been exacerbated through the pandemic. These important resources will complement existing efforts to combat overdoses in our community, and we look forward to the dialogue. The Cuyahoga County Board of Health is the lead for the CDC Overdose Data to Action initiative, focused on obtaining high-quality, comprehensive, and timely data on overdose morbidity and mortality to inform prevention and response efforts, in addition to a range of other services. There are 14 local agencies that have come together to openly share data, collaboratively seeking solutions, and connecting people at risk for overdose to places where they can receive care. This work represents an important demonstration of unity and purpose to combat this difficult epidemic. Here are a few examples of the work that we're doing. The Board of Health has also partnered with CASE through the Began Center and with the Cuyahoga County Medical Examiner to develop a drug overdose integrated epidemiologic profile known as our Overdose Data dashboard. This dashboard represents a data-driven resource for local partners and community members to understand current drug overdose trends, patterns, and risk factors in Cuyahoga County, and to make recommendations for allocating drug overdose prevention and care resources, planning programs, and evaluating programs and policies. These data can be found on our website at ccbh.net by searching Overdose Data Dashboard. The Overdose Data to Action program also supports a range of other prevention and response activities in the community. This includes Metro Health's Office of Opioid Safety, which proactively offers educational opportunities for providers, increasing awareness on the impact of substance abuse disorder and alternative treatment therapy for pain management, as well as community dissemination of naloxone through Project Dawn. They work with law enforcement to respond to non-fatal overdose events and direct clients to treatment, saving lives and offering the opportunity for a fresh start. St. Vincent Charity Hospital's extensive experience in addressing overdose and substance use disorders has been integral in our program. They continue to screen all individuals entering their medical system and linking people at greatest risk to places where they can receive care. The Center for Health Affairs coordinated development of policies and procedures integrated in medical systems of care for those at greatest risk of experiencing opioid use disorder. The toolkit and educational portal also has modules which share the most up-to-date clinical information available on addressing substance use disorder. On the community front, Thrive, the Woodrow Project, and Circle Health Services are agencies that provide critical peer recovery programs that create awareness and connection to opioid use disorder treatment and other medical and social services in the community for individuals, families, and friends who experienced an overdose. We're glad to report that we continue to see an increase in the number of people connected to services through these evidence-based harm reduction strategies. All of these services will connect with the newly funded programming at Rainbow to expand an integrated system of prevention and care in Cuyahoga County. Changing gears to our COVID update, I'm happy to report that we continue to see improvements in our trajectory for COVID cases and vaccinations. About 51% of Cuyahoga County residents overall, that's over 625,000 people, have started vaccinations, with 45% of all residents and 55% of adults having been fully vaccinated. Importantly, 77% of adults over age 65 are fully vaccinated as well, which has substantially reduced the rate of hospitalizations and fatalities. We continue to see incremental improvement in vaccinations rates across race and ethnicity, and we are concentrating our efforts on continued improvements. Case numbers continue to trend in the right direction, as we're now seeing less than 50 cases reported per day at the Board of Health and less than 100 countywide, and that number continues to drop. Our testing positivity rates, as reported by hospitals and all reporting labs, also continue to decline. These welcome trends are consistent with those seen around Ohio and nationally. As we're all well aware, Ohio Department of Health Director Stephanie McLeod signed an order earlier this week that rescinded a number of COVID-19 related health orders. There are a few orders that do remain in effect, including the required screening for COVID at certain facilities like nursing homes, and notification and reporting of cases from these facilities and K through 12 schools. This reporting allows for more thorough and effective contact tracing and ultimately can help minimize viral transmission. Please remember that masking is a critical prevention component in congregate sites where people are grouped together and where transmission risk has always been the highest. At the federal level, requirements related to health screening, distancing, and mask wearing will continue on public transportation and at hospitals and other medical providers. They will require these prevention measures also in other healthcare settings. Guidance for summer camps and other seasonal events has been developed by CDC, and our call center continues to advise residents, businesses, and other institutions on best practices and prevention. It's important to remember that with the state orders ending this past June 1st, the risk of transmission among unvaccinated people remains. It's recommended that those who have not been vaccinated continue to wear masks in a public setting and follow other safety protocols, especially while indoors. This approach will protect them and others around them. Businesses and other places of employment can establish their own protocols for social distancing and maintain current mask wearing requirements. We'll continue to see a percentage of customers and coworkers who are more comfortable continuing to wear masks in stores and in their workplaces. Some folks may have medical reasons why they can't be vaccinated. We all need to remain respectful of each other and ease into what this new normal will look like. Following a year of wearing masks, observing social distancing, looking at stickers on the floor for the distance, and standing behind plexiglass shields in stores and 6 feet from others, given all that, it's imperative that we show some kindness and understanding when we encounter those around us who may not be quite ready to interact closely with someone they don't know. Washing our hands routinely and monitoring for symptoms will continue to be important as we congregate more frequently in larger groups and attend social gatherings and parties. And we encourage you to do this outdoors in the wonderful weather we'll be having. Vaccination remains, of course, the best way to prevent COVID exposure. COVID vaccine is widely available across 136 locations all over the county, just around the corner in many locales. Pharmacies, hospitals, and community health centers, the Wolstein, the Cuyahoga County Board of Health, and the Cleveland Department of Public Health are all offering vaccines in many places, including walk-in appointments. It's now easier than ever to get that shot and get access to the life-saving vaccine. The Board of Health continues to offer a range of community vaccination opportunities with a focus on continuous improvement of our equity and access to vaccine. And I'd like to thank our equity, diversity, and inclusion team at the Board of Health that have worked hard on community messaging, door knocking, and sharing flyers in neighborhoods, along with other outreach efforts in areas around our equity clinic sites. The same team has been very active since the start of the pandemic, providing food, medication, and a range of other support services for those needing assistance in quarantine and isolation. I'd like to take a moment to acknowledge the extraordinary leadership of our EDI team leads, including Michelle Shaw, Roger Sykes, Monica Baker, Levon Lee, and Morgan Hammonds in delivering these essential services to those most in need. We also continue to offer vaccinations in coordination with community partners on a range of congregate sites to keep the risk of transmission down in these group settings, including among developmentally disabled, at recovery houses, incarcerated populations, and other venues. For the near term, we have clinics planned for a range of locations, and you can register on Get the Shot website for a walk-in vaccination near you. We'll be holding clinics. Today we're out in Newburgh Heights. We're at the Board of Health here every Monday. We'll be in East Cleveland at the Salvation Army, the Bedford Heights Community Center, a couple churches in Euclid, as well as then following up back in Newburgh Heights and other locations for a second dose. But we'll take anyone that comes in is interested in being vaccinated. You can also go to our website where a range of additional locations are available for clinics near you. As a reminder, these vaccines are free to everyone. We continue to work with the COVID Rapid Response Fund partnership coordinated by area foundations. This is a group comprised of a wide range of grassroots agencies that meet on a weekly basis to spread the word about these and a wide range of other vaccination opportunities available in the community. As a reminder, the mass vaccination site at the Wolstein Center is offering Pfizer through June 7th, which will be the last day for vaccination at the Wolstein Center. Individuals receiving their first dose at the Wolstein within the next week will receive their second dose at Discount Drug Mart, scheduled at the same time as their first dose. Wolstein accepts walk-ins from 8 a.m. to 7 p.m., and you can also book on gettheshot.coronavirus.ohio.gov. Please remember that while we're all very glad that the overall situation continues to improve, this pandemic is not over. The best way to protect yourself has always been to get vaccinated. We stand in full support of the national goal of vaccinating 70% of the U.S. population by the 4th of July, and will continue to do our part to meet that goal. Getting vaccinated has never been easier, so please take the time to protect yourself and as many others as possible. Roll up your sleeve and take the shot. I'd like to transition now, Jonathan, if I could, to our weekly Epi Brief. Thank you. So as you see here at the top, our case number has been going down as I described. These Epi reports are done weekly as a way to provide a sense of trends of what's happening, and over time you get a sense of our trajectory overall. So cases are less. During the time of this report, it was about 60 a day in our jurisdiction, 100 countywide. We're now down to about 50 a day and less than 100 countywide. So we continue to move in the right direction. Our fatalities have slightly increased by 1. We saw 11 last week, 12 this week, but generally our fatalities have been decreasing. So if we continue to move down the page, you'll see that so far among our cases, 55% have been female. We see the highest age group that has been fairly consistent is our 20 to 29-year-olds have the highest rates of cases. It actually ranges in that from the 20-year-olds through age 59 are the highest rates of overall cases. If we look at race, you'll see that 57% have been white, 23% have been African American, 12% are unknown. There are 2% Asian and 6% are of other races or ethnicities. About 8% are healthcare workers. And if we move down and look at our ethnicity, you'll see about 3% have been Hispanic Latino, 20% have been unknown, and about 25% of the folks that have been that have contracted COVID have had pre-existing conditions. We'll move on to our dramatic epi curve, which really tells the story, I think, on the 4 waves that we've seen from the response. If you look at your far left, you'll see that that was our initial start in March, which seemed at the time to be a significant amount of cases. We learned certainly that that we were just getting warmed up in this pandemic in terms of what was about to come. And we saw then in the mid-June to mid-July, we saw our surge. And then, of course, we had our mask mandate, which helped to drop cases significantly. Then came the fall, and we hit our huge climb where we, at our worst days, were seeing upwards of 900 to 1,000 cases a day. We then came down into the late winter, into February, and saw a bit of a surge in March and April, and now we're descending again. It is our hope that increasing vaccination rates, as well as those that have been exposed that are protected, will all add to our overall community protection. And that is why some of the changes in the guidance from CDC around masking have been put forward. So if we look at the next map, this is very consistent. You'll see we continue to see stable rates of cases by zip code. We've been reporting this for many weeks on end. And so we'll move on then to our hospitalization data. And overall, what we're seeing is that COVID cases have been down. They're seeing COVID in the hospitals, but it's been down significantly. And much of the utilization, which looks fairly constant there, if you look at the lines in terms of medical beds, are because of delayed care and elective surgeries and other procedures that people are seeking or in need of. We are glad to see that yellow line at the bottom, which is our ventilator use, is trending down, and we see that also as a very, very positive indicator. Moving down the page, you'll see we have our overall testing data. Among the major hospital systems here, you'll see that we've been dropping from 4.6% to 3.9% in late May, and we're pending. Some of the data is pending, but we expect that the numbers will continue to drop for the hospitals. If we look at our overall countywide electronic reporting data, you'll see the same trend from 4.1%, a month ago, at about 68,000 tests, now to about 3.3% of all those that report. That's the labs, all testing centers, including hospitals. So those trends are positive and continue to drop, and every shot in the arm will cause those rates to continue to drop. So that's why we're going to continue to promote vaccination at all fronts in all communities. Moving on, you'll see our overall vaccination data from our county, and as I mentioned, we're now at almost 51%, but we've seen now that we have a good chunk of folks that do come back in for their second dose. So we do see upwards 85% or better of people that do come in for their second dose, and that among the vaccines, Moderna and Pfizer, that are a 2-dose regimen. Moving down, you'll see that we have at the Board of Health ourselves done over 60,000 vaccinations. 55% of those have been among females. And you'll see the age range groups of folks. We are starting to see the folks 12 and up is starting to creep up because we're seeing more of them come forward with the expanded use of Pfizer, and soon Moderna will have expanded use by age. So those numbers will continue to climb as well. 71% of those that have been vaccinated are white, and 27% of those that are vaccinated have been Asian, African American, or other races, and 3% are unknown. 3% of those have been Hispanic, Latino as well. And so we are moving in the right direction. Congregate sites still represent a place where we can see transmission. We are seeing breakthrough cases in the community. That is expected with any vaccine, that you will see breakthrough cases. They've been are under 1% of overall cases, but it's important that we monitor this very closely going forward to track the variants that may be continuing to emerge. And of course, we reported positive news earlier this month that we only saw one flu fatality this year, a record by far and away, a better year at reducing flu fatalities, hospitalizations than any year prior. And that's because of masks and distancing and working remotely and the like. So with that, Devin, that concludes my report. Very positive, and I would turn things back over to you.
Thank you, Terry, and thanks, Executive Budish. We now have a few minutes for some questions. I know we have one reporter on from Channel 5, so if you don't mind unmuting yourself and asking your question, please. Thank you.
Hi, this is Amanda Merrill from News 5. I was wondering if you could address the CDC warning about teens and the increasing number of severe cases and hospitalizations, and whether we are seeing that also play out here locally.
Yes, there's been some new CDC data reported around seeing teens. I think with severe cases and more, and as we move into the pandemic, I think the concern has always been among younger folks. If you look at our case data, we've seen a lot of cases among younger folks. But as we move forward into the summer months here, we're going to see a lot more interacting with teens. Many of them are, of course, until some of the recent guidance that increased vaccination availability to younger folks, you would expect to see that they were really not in a position where they could be vaccinated. And so certainly masking was encouraged by us and has been encouraged by us in the school setting through the end of school. We think it's important to do that in indoor settings, and we've advised that in our weekly guidance to our superintendents as they finish out their school years. And of course, that makes good sense where they're able to do that. But I think it really puts the risk that COVID can affect anyone, even young folks, and it can have severe effects on a subset of people in the population. So what we want to do and continue to do is to urge everyone that's eligible to be vaccinated, with the anticipated approval and the offering of Moderna to also be available to younger people age 12 and up. And then, of course, further clinical trials opening that up to people even younger, into very young kids, that will offer opportunities as we move into the summer and fall to have more people covered throughout the population, which will further increase our overall protection in the community. But I think it highlights that risk does occur. It highlights that the virus is out there and will take advantage of places where people are not vaccinated. And so we encourage our young folks to roll up their sleeves and get vaccinated, and also to stay in touch, of course, with their parents and families, with their providers, to seek care as they need it. And that vaccine is available for those 12 and up. And we encourage all parents to really consider getting their kids vaccinated.
Thanks for your question, Amanda. Any other questions? All right. Well, thank you very much. That concludes this week's briefing. Thank you for joining us, and we will see you in a few weeks. Have a great weekend.
Thanks.